60-plus-year-old farmer that comes to the clinic every year for his physical exam and blood pressure beds and all that. And last year he came and his weight had gone up a little bit, and we checked his blood and his blood sugar was up a little bit. And we had a talk about all that, and I said, "You're getting to the point where you might be having diabetes." His blood sugar wasn't in the diabetes range, but it wasn't in the normal range anymore either, so we call that pre-diabetes. And so we had a nice talk, and we got him lined up with a nutrition class that was going on at that time for pre-diabetes. I refilled his pills, sent him on his way, expected him to come back the next year like most everybody does, a little heavier, blood sugar's a little higher. But he comes back this spring for his physical, and here his weight is down 20 pounds, and his blood sugar's normal, and he's feeling better, and you can tell he looks better. And I'm always interested in those cases because somehow or another he changed his life around and adopted a healthier lifestyle. And I always ask those people how they do it because it doesn't happen very often. And he said he basically took the classes, cut out a lot of starches in his diet, started walking a couple of times a day, and that's how he did it. And I think that demonstrates how good preventative care can help prevent diseases in the long run from him. Otherwise, he'd be coming in later with diabetes, his blood pressure would be higher, his knees would start wearing out, and so we'd start finding all kinds of problems. Now he's probably prevented some of those, or at least put them off for a few years. I give that lecture to just about everybody I see for a physical, and actually most people don't carry through with it. Most come back the next year the same or worse, but every now and then people actually do those things and accomplish their goals. That's kind of exciting to me.